In our Let's Talk About It stories, we try to break down the stigma around getting help for mental health issues. And there's one disorder with some surprising statistics. According to the Johns Hopkins All Children's Hospital, eating disorders have the highest risk of death of any mental illness.
More often than not, they go unnoticed. Children are being diagnosed with eating disorders at high rates across our state, and doctors say they've spiked since the COVID-19 pandemic. News Center Maine's Ann Baldridge spoke with people on their road to recovery and has more. Hi, Ann.
Hi, Brian and Sam. Eating disorder experts I spoke with say these disorders thrive in secrecy. Eating disorders take many forms, from eating a lot to not eating at all. The woman you're about to meet has learned the hard way what it means to fuel your body rather than starving it.
I was trying to spread out what I was eating to try to curb the hunger pains.
Jennifer Beagle remembers when it started.
I was trying to eat as little as I can, maybe 600 or 700 calories some days.
After a 10-year relationship ended, she developed an eating disorder.
And I lost so much weight. I started losing chunks of my hair. I got a stress fracture because I was also over-exercising.
Over-exercising and under-eating.
If I ate something small for breakfast, I wouldn't eat lunch. I'd be like, oh, I already ate today. And then I started to weigh myself daily, and that would determine if I had a good or a bad day.
Jennifer learned she was suffering from anorexia. It got to the point where she was afraid she may pass out at work, all in an effort to feel skinny.
And I wouldn't eat lunch. And on my lunch break, I would run 3 miles. And then after work, I would run with a friend for another 4 miles.
Jennifer lost 25 pounds in the first month. Then 25 turned into 60.
There's a huge stigma that you have to be either really big or really, really skinny for people to, and I think you have an eating disorder, and I'd really like to break that misconception and stigma.
But her doctor noticed right away and connected her with a nutritionist and a therapist.
The sad reality is that actually eating disorders have quite a high mortality rate.
Lindsay Susie is the clinical director at the New England Eating Disorder Program. She says that they treat people as young as 13 years old.
Eating disorders impact all ages, all races, all genders, all socioeconomic groups, and they don't all look the same. Huge uptick in diagnoses right at the start of the pandemic and through the last several years.
Lindsay says eating disorders often go underreported and undertreated.
We hear our minor patients who are still in middle school and high school talk a lot about, gosh, I'm learning all of these things about what you're teaching us about eating disorders and body image. And I have all kinds of friends in school that don't eat or do these same behaviors or say these things about themselves.
Getting help and ultimately recovering is not easy, something Jennifer knows firsthand.
Recovery isn't perfect. I still have to stop myself from weighing myself every day. I have to be intentional, so it's not like I'm just healed and everything is better. It's something that I work at every day.
People often battle eating disorders for years. Doctors I spoke with say these disorders do affect your body's ability to function. If you think you, your child, or a loved one may be suffering from an eating disorder, there are signs to look out for: rapid weight gain or rapid weight loss, someone who is saying I'm not hungry or I already ate, going to the bathroom after eating, or someone who is uncomfortable eating around others. Remember, seeking help is essential. If you or someone you know needs assistance, there is help. Services are available through agencies such as the New England Eating Disorder Program at Sweetser. Brian and Sam.
Tough conversation, but an important one, and thank you.